Hi, thank you for joining me today. I'm Alyssa Grimshaw, one of the biomedical research and methodology librarians here at the Harvey Cushing John Hay Whitney Medical Library. This short session is part of our What's the Difference series on evidence synthesis methodology. We'll compare integrative reviews and scoping reviews. These two approaches are often confused because they both allow for broader inclusion criteria than systematic reviews. However, their goals and outputs are quite different, and understanding that distinction can help researchers choose the right methods for their project. By the end of this short session, you should be able to describe what integrative and scoping reviews are and how they differ. We'll focus on the purpose of each review type and the kind of synthesis they produce and situations where one approach may be more appropriate than the other. The goal isn't to cover every methodological detail, but rather to help you recognize when each review type might be the right choice for your research project. Whenever we're discussing evidence synthesis, I like to quickly mention the availability of librarians to collaborate with you on these projects. Please feel free to reach out to us or check out our website to learn more about our services. We do also have tools available to assist with your evidence synthesis projects. EndNote is available for download in the Yale Software Library, and Covidence is available by contacting the library. Please reach out to me or your librarian if you would like access. What is an integrative review? An integrative review is designed to bring together different types of evidence, not just clinical trial or observational studies. These reviews may include quantitative research, qualitative research, theoretical literature, and methodological papers. The goal is usually not simply to summarize the evidence, but to develop new interpretations, frameworks, or perspectives about a topic. For example, researchers might conduct an integrative review to understand how patients experience chronic illness, combining qualitative studies with conceptual models and clinical research. Integrative reviews are common in fields like nursing, education, and social sciences, where understanding complex phenomenon requires multiple forms of evidence. On the other hand, a scoping review has a different purpose. Instead of developing new theories or interpretations, scoping reviews aim to map the existing research landscape. They're often used when the topic is emerging, complex, or poorly described. Researchers conducting a scoping review might ask questions like what research has been conducted on a topic, what study design are being used, where are the gaps in the literature. The goal is to provide an overview of the evidence rather than critically synthesizing results about effectiveness or outcomes. One key feature of these is often the research question is a broad research question that could have multiple answers rather than seeking out one specific answer. This table highlights several different dimensions where these two review types differ. First is purpose. Integrative reviews aim to generate new conceptual insights, while scoping reviews focus on mapping what research already exists. Second is the type of evidence included. Integrative reviews intentionally bring together multiple forms of knowledge, including theoretical and conceptual literature. Scoping reviews also may include a wide range of evidence, but typically focus on describing studies rather than integrating them in conceptually. Third is the type of synthesis. Integrative reviews often involve interpretive synthesis, where the authors develop new perspectives. Scoping reviews instead provide descriptive overviews of the literature. Finally, the output differs. Integrative reviews may produce models, frameworks, or theoretical insights, while scoping reviews typically produce evidence maps and identify gaps of knowledge. Scoping reviews also have their own reporting guideline extension, Prisma for scoping reviews. Integrative reviews do not have their own reporting guideline, but the guidance in the literature is to use Prisma. Some areas of Prisma may not be relevant to your study, and you may want to compare a few of the different extensions to include additional checklists and find the most appropriate one for your study, or you may need to put two together. which is totally acceptable in the methodology to use multiple of the reporting guidelines if it's needed. You may say, wow, after watching the systematic review versus scoping review video, integrative review sounds more like a systematic review than a scoping review. They're both generating new data. Here's a bonus slide with a comparison between integrative reviews versus systematic reviews. For more information on systematic reviews, please check out that other video or one of our more in-depth videos or classes. This table compares integrative reviews and systematic reviews, which are commonly also confused. Systematic reviews are designed to answer a clearly defined research question using a structured and reproducible methodology. They typically focus on empirical research studies and aim to synthesize findings related to a specific intervention, outcome, or phenomenon. Integrative reviews, in contrast, often take a broader approach and intentionally include multiple forms of evidence, such as theoretical papers or qualitative studies. Another key difference is the type of synthesis. Systematic reviews use structured and transparent approach, and in some cases may include a meta-analysis. Integrative reviews instead focus heavily on interpretation and conceptual integration of diverse evidence. Finally, the outputs differ. Systematic reviews often inform clinical practice, guidelines, or policy, while integrative reviews frequently result in new conceptual frameworks or perspectives on a topic. So there's a lot of similarities across these review types. So both integrative and scoping reviews share several characteristics, which is one of the reasons they're sometimes confused. Both methods often address broad or complex research topics rather than those narrowly focused clinical questions. They also tend to include diverse types of evidence and multiple study designs, unlike systematic reviews that may focus on a specific type of study. These approaches can be more flexible in what they include. Another similarity is that they both typically rely on narrative or descriptive synthesis rather than statistical pooling. Finally, both approaches are particularly useful when the topic is emerging or not yet well defined, helping researchers understand what evidence exists and where future research may be needed. Both integrative reviews and scoping reviews should be using a high quality evidence synthesis workflow with transparent and rigorous systematic approaches. So, choosing the right approach. An integrative review is useful when your goal is conceptual development. For example, if you want to understand how different types of research contribute to a broad theory or model, integrative review is the one for you. A scoping review is more appropriate when you need to map what evidence exists, especially in emerging areas where research is not yet clearly organized. In many cases, researchers conduct a scoping review first to understand the landscape, and then later conduct a systematic or another focused review once the evidence base is clearer. Again, it's not about one being better or more rigorous. It's about picking the best tool in the toolbox for the job that you're trying to do. So we want to find the review type that's best fit for your research question. So, also an example application. These two questions focus on the same general topic, clinician well-being, but have very different goals. So, a research question may ask what research exists, what interventions have been studied, what outcomes have been measured, and in this instance, it's what types of interventions have been studied to support clinician well-being in hospital settings, and how have those outcomes been measured. On the other hand, integrative reviews questions ask something different. How do multiple factors interact? What's the broader understanding emerges across different types of evidence? Here, our question is, how do organizational, psychological, and social factors influence clinician well-being in the hospital setting across different types of evidence? So even though our overall topic is the same, clinician well-being, the purpose of the question really determined the review type and which one is the most appropriate approach. So our key takeaways. Integrative reviews are designed to synthesize diverse evidence to generate new perspectives. Well, scoping reviews aim to map the existing literature and identify gaps. Choosing the right method depends on the goal of the project and whether the aim is to interpret evidence or understand the research landscape. If you have any questions, please feel free to reach out to me or to your research and education librarian.